Namaste and welcome to all of you, Easy Ayurveda family, all the members, to yet another session of Gurubodha. So, episode 109 of Gurubodha. It's been a fantastic journey, and we are continuing with all your support and all you wonderful people being here. So, every time supporting us in Gurubodha, Gurukula sessions, making these sessions wonderful platforms for discussion for various resource persons to come over and put forth their thoughts, and then we will have discussions, interactions, and lot more to make these sessions very interesting sessions. So thanks yet again and welcome to all of you to Guru Bodha session. Today again we have a familiar face, Dr. Ashlesha Rawat madam. Welcome to this particular session, madam. Namaste and welcome to Guru Bodha. Being here, Vaidya Ashlesha Rawat madam will be the guru of this session. So we will have like a continued session. So from where we left over with Ashlesha madam in the last session. So when she was with us discussing on women's health and various perspectives and facets of women health, that was a fantastic session. Before that, I would like to give a brief introduction of Ashlesha Rawat madam. So she is Ayurveda Vaidya, MD in Rasa Shastra, and currently working as she holds many portfolios and comes up with immense oceanic experience in various fields, including Ayurveda, Yoga, dietetics, women care, Shastra, and a lot more. So apart from being a very good teacher and a down-to-earth human being, so she is the director of Ananda Ayurveda Academy USA, and also she is a nutritional consultant and also holistic health practitioner and registered Ayurveda specialist, board-specified integrative medicines, and a lot more portfolios, as I said, that she holds. So welcome Dr. Ashlesha Rawat madam to this session once again on behalf of Easy Ayurveda and all of us.
Thank you so much, Dr. Raghuramji, for your kind introduction. It's always a pleasure to be here.
Continuing from where we had left over last time, so as we see that in the previous session where Dr. Ashlesha Rawat madam took the stage and covered many facets of like the health of a stree, so like the woman, so how important she is, and different stages beautifully covered of a woman, right from the childhood, so adolescence and adolescence problems, what we discussed in the previous session. So touching up from there, so we will go to the point of conception right now. So continuing from after Shodhana, what happens? So generally, see, there are girls, madam, who take up careers. So like, and they go on for extended part of the education. They hold various portfolios later after getting into great titles of education. So they are very much passionate in studies and would like to take it ahead. And there is a constant pressure in the families, especially in the girls, when we see in the Indian scenario also. So the worry for the parents is to get the girl married at a particular age. So like, so the definition goes like, parents also have their views, perspectives. They also have their parents, like grandparents, etc. So there is a pressure from there. So there is a lot of pressure from other parts of the family as well on the parents, that why you aren't getting your girl married. So the same pressure may not be there when there is a boy. We are not exactly speaking about the discrimination. How would the girl handle these pressures of the family, number one, and what is the right way to handle? So because it is a difficult scenario for her. So because a girl also, be it a girl or a boy at a particular age, when they have crossed the teenage, there are lots of dreams, perspectives of life. They want to explore a lot of things, to travel all around, to learn more, to become something wise. They're influenced by a lot of people. Influence is yet another factor, and they want to achieve something great in their life. Marriage, probably, so the institution of marriage coming into the way in the form of a pressure some girls may take. Some girls are ready and prepared to take up that particular responsibility of the institution of marriage. So there is a dilemma going on in a girl's mind. So probably as a woman, you would be the better person to address this. How should a girl look at this particular perspective? So how best she can do to achieve her dreams, to go and prepare herself before going into the institution of marriage?
Yeah, I think this is a really wonderful question. As we know, we have already talked about, I have emphasized this, that every stage of female is important. Every stage. So just to recap, as we said in Ayurveda, we have the different stages divided as like from newborn to 10 years, we call it as a Kanya. Then 10 to 12 it is, we call it as a Bala. Then 12 to 14 is the Artava Darshini, when the menarche starts, and we discuss a lot. And then 14 to 16 becomes the Shodishi Rajaswala, that is that adolescence age come. And then we come to now what you were saying, 16 to 40 years, which is Yuvati. So Yuvati, the name itself suggests that with something with a full pitta becoming very, very apparent in life. So it's a till the Shodishi also she is in the Kapha stage of life. Now as she starts going towards that age becomes the Yuvati. And Yuvati being the Pitta stage of life, as you said, that yes, she has many aspiring dreams. And that aspiring dream she has to fulfill at the same time with the people like a scenario with the parents, and they want to get the married daughter should be marrying, and then she has to have kids, and all these things are absolutely true, that she everyone would expect, because that's the feminine, one of the extremely important I would say it's a responsibility of the feminine power, that to give a child a birth could be a responsibility. It is not just responsibility for as a in unique individual, but it is a responsibility as the creating for the family's generation ahead, right? And as well as the social, the continuation. Why I'm saying this social aspect is also important. Not just I know in Bharat we have this problem of population, but I'm living here in United States, and in US, in certain part of the country, actually there is a population is going down, and the cities are encouraging these females to actually produce kids. So people are suffering there. So these type of scenarios are also there. So coming back to your question, that how a female, a Yuvati, can prepare herself. How should she handle the pressure first of all, and then prepare herself? So first of all, this preparation, as Ayurveda has already mentioned, that the age of the female again is been said as a shodashi, like after 16 she's ready to marriage. Of course we generally don't allow, and legally also now it is not possible, and we allow absolutely the 21 year for the marriage, which is true, because in that sense some basic graduation and education has been done. Education is an extremely important point, and then physically also she gets absolutely ready for living the thing. So my personal advice always would be that whatever you have to do at that age, always do that at age, and don't push that further. Having said that, because what I am seeing in my practice, this is really another thing which I would like to touch base, is now that so much of equality has been coming up, that the male and female are now equal, and people want to live that way and want to actually absolutely divide the work aspect and everything. At the same time, it is necessary that female is the only one who would have the babies, right? No matter whatever will happen, the other partner cannot really do that job. In that process, it is necessary that certain things to be done on the right time. What I am seeing is that these new generation is basically going more and more on having that freedom of doing everything, and then postponing actually the pregnancy. And then they are crossing 30 and 35, and then they reach to 40, because Yuvati is only from the 16 to 40. Later on, whatever starts, it's a menopausal age, or the perimenopausal age can also start. So generally, typically, by definition, perimenopausal age starts, it says 6 years before menopause, around 6 years before menopause. So around 40, 42, 45, this is the age when everything is kind of going to be in decline stage and going to be in Vata stage. So absolutely, this period again becomes very, very crucial. It's not, even if you have female would have many ovums, but every month only one ovum is going to get mature. So the opportunity to have the babies would be only one time in 1 month. I mean, one ovum is anyway, no matter how many ovoms she would have, but only one ovum would get. In that process, the timing aspect really becomes very important. Makes sense? So that's the reason. So that's why that she has to be getting conceived, that is, and the appropriate time. That's the first process. Then how I'm coming to the how it should be done. Basically, in Ayurveda, we always go on the 3 level. Number 1 is Ahara, right? Number 2 is Vihara. Number 3 is Aushadhi. Now, even before specifically talking about the getting ready, I generally focus on the 4 level aspect. And one is Ahara Vihara, first, second keeps the same way, and third becomes the Achara, and then fourth becomes a Vichara. So these 4 aspects have to be very nicely prepared, should be preparing. So the female should be preparing herself at all these 4 levels. And I know Yuvati being, it's a challenge in this era that you are working also and you want to, get married also and then have the baby also. It's definitely juggling the things around, but it is still necessary that one must do that. So preparing herself at the level of diet is where we generally expect that female should give the preference to the absolutely completely balanced diet. Now, how is this balanced diet? I'm not just typically saying that, okay, have this much protein and have this much of, carbohydrate and fat. I mean, that anyone can do. I'm talking here more from the approach of Ayurveda. Now, in that respect, I would say give preference to more as Rasa Dhatu, where Rasa Dhatu can be more fulfilled. Of course, Artava Dhatu is important, but it is doing its own natural job and it should be in normal stage. But increasing the Oja aspect and further enhancing the Rasa Dhatu would actually be helpful. And in that aspect, whatever the Ahara she has to do, whatever the Vihara she has to do, one should do that. Talking about the Achara and Vichara, I will cover that aspect more during the pregnancy aspect, as we would go. But if I have to give you again a simple aspect, that how do we actually do the Rasa Dhatu, right? How Rasa Dhatu can be kept more fulfilling, then I would recommend that simply even drinking proper amount of water can be helpful for the Rasa Dhatu. All fruits are excellent for the Rasa Dhatu, and specific speaking, one can actually start the Amalki, Amla, Indian gooseberries would be another beautiful aspect that one can start preparing with. I'm just saying about even the premenstrual as preconceptional aspect that she can start preparing herself. Another very valuable advice I would like to give is taking the rest during menstruation is truly important. We discussed this last time to some aspect, but always remembering one point, we must remember that we are not just preparing for that stage and during that time. We have to prepare always beforehand the actual stage is going to come. Which means if you're deciding that, okay, someone wants to become pregnant, then at least 1 year the preparation should be started. And this does not mean that you have to start conceiving that way, but you have to look onto your diet, you have to look onto your lifestyle, you have to look onto examine yourself at the level of how is your mental state, how much exertion you are having in your life, how your lifestyle is going on. All these things are very necessary, and then you together with partner take a decision that now I want to choose this period. And again, do not delay sincerely after 30, and that should be the target 21 to 31 at the most should be the target for having at least first child. And this is really a problem nowadays. You would see that more and more late, more praudha are becoming. The late pregnancy is really challenging. At least in US, late pregnancy is becoming a very. I'm not really sure how much that is in the Bharat as of now, but in US, this is a real problem, which I say that they come itself late for the infertility. Yeah.
That was like extremely touching upon different facets of how a girl should prepare herself. The question was how would a girl handle the pressure, first of all, entering into the institution of marriage? As you rightly said, madam, these fertility issues are on a surge. So that's why the parents are concerned. So it should go, all the events in one's life should go according to a particular plan. So that is the era in which we are living in. So parents are more concerned about certain things. So there is a pressure on them also. Then they transfer that pressure on the girl. The girl should how to handle those pressures. A balance. So achieving the goals, achieving the dreams, getting into the institution of marriage at the right time, and also conceiving the child. So everything goes on step by step. So that's wonderful points that you have covered. So this transition is a very tricky transition, I feel. Men and women both will feel the institution of marriage because it is a new institution in which they have entered. They have to understand each other, the life partner especially, and very importantly in Bharat, as you mentioned, understanding each other's families also becomes important. It's like association between families. So there is added pressure on all sides. Ultimately, it will be the boy and the girl, or the husband and the wife, to work with the chemistry between them in the initial phases of the years. So understand each other, so physically, emotionally, and in all ways, and take a decision. So this is the right time that we need to conceive the baby. So taking even the modern day picture into consideration. So it's both of them, the couple should sit and decide. So having said that, there is also a pressure, just like the marriage, there is a pressure in the family also to conceive the child. Again, seeing the fertility issues, we are not trying to judge who is correct and who is wrong. So the life needs to go on, and so planning not to have a baby, so that's a different issue. They can take a call, and if a boy or a girl, so that is a couple, if they're planning to have a baby, then definitely things need to be planned. And as you said, since the fertility issue is on the big surge, so do not delay. That is the golden words that you have used. So like a decision is very important. Emotionally, physical, mental, emotional readiness to carry that responsibility of getting a new member into your family and new life into your family, and being prepared like in all directions, that we now are ready to take care of the new life which is going to come into our life. So that should be the decision collectively taken, and when they're taking, it should not be a hurried decision. It requires a lot of things: physical preparedness, mental preparedness, emotional preparedness, and a lot more things add up to this particular responsibility. Just like marriage, having a child, as you mentioned, at least having a first child is the biggest responsibility. That is a new institution for parents also. They are also like getting the birth as parents. So once, so until they give the birth, they are not parents. Once they give the birth, they become parents. So that is another phase of their life. So for this, a lot of economical preparedness also nowadays people are seeing, and also how well we are settled and all those things. So amidst all these things, we shall not lose the game of enjoying any particular perspective of, especially of being the parents. So that will be a proud point in everybody's life. So we've also seen so many people don't have a progeny, so at least one child in their life, and they're so much worried. So thanks for covering all those facets, madam. And having said this, the preparedness, Ayurveda also speaks about certain preparedness, like Shodhana should be given to the couple. So the man should undergo Shodhana, woman should undergo Shodhana, and then and some medicines, and also in a woman before conception, the cycles, how the cycles were going on. So what is the health and status of the woman who is ready to conceive, and all those things. Ayurveda acharyas also have mentioned the Rutu Kshetra, Ambu, Beeja, and all those concepts. The health of those things, the menstrual regularities of a woman, the health of the reproductive system, and also in man, if we see the health of sperms, whether all those things, and also how much they are prepared, everything. Question number one is how would you look at this particular scenario, Ritu Kshetra, Ambu, Beeja, explained by Ayurveda, to be prepared, a man and woman to be prepared, apart from being physically, mentally, and emotionally fit? The Shodhana aspect, how practical it is in the modern day life as a part of the preparation. Will it really help in having healthy babies? Number one. So that is, how do you see this particular perspective? So we shall add the question later. So what do you see, madam? So like this Ayurvedic explanation about this part of preparedness and taking some medicines to get 100% sure. Question number two also I'll add up here. Would there need a counselor? So somebody to sit and speak to both the couple individually and also collectively and train. So we have seen in modern day, like people go to the classes to get coaching of how to get a baby, how to conceive a baby, how to take care of a baby after the baby comes into their life. So how do you look at these aspects?
Yeah, so as you mentioned, yes, preparedness in, question number one, I'll take, as you know, you said two questions, right? So first of all, when you're talking about the preparedness, absolutely preparing is the most important thing. It is not, I always say, don't think that, there is always phrase like we are going to take a chance. People say we are going to take a chance, and I would always correct them and say, no, you're going to make a choice. You're going to make a choice of pregnancy. Don't say, I'm just taking a chance. So when you say going to make a chance, it's just like, okay, it's a casual aspect. No, you should be actually preparing yourself to make a choice of a healthy baby, correct? I personally, in my practice, I have this whole project. We do as a specific field of, we call it as a suprajananam, right? So that's a special program I give in my practice. And what we do here, as exactly what you were saying, is the Shodhana Kriya. So according to me, that Shodhana Kriya is really important. And how practical it is, absolutely, if you give chance, if you choose something, then it is definitely practical. I generally would ask them that, tell me, when you wanted to take a plasma TV, that smart TV, which is big, 48 inches and this and that, what did you do? Did you just go and bought? So, no. We sat down, we researched, we saw this, we saw that. So that if you are ready to spend so much time for just buying something which is a it's just a material thing, here you're dealing with a completely life, right? Which is going to be that baby, which is going to be your angel for your life. And that you cannot just go and, okay, we are taking chance. That cannot be possible. Then you have to give time for yourself to prepare yourself, correct? And that's the first choice you should be making. And as you said, that yes, they have to socially, mentally, financially, everything, they have to be prepared that way. And so as they have to prepare the physical aspect also, correct? And that's why Ayurveda has given this beautiful aspect of Ritu, Kshetra, Ambu, and Beeja. So at 4 level, they have to be prepared. And let me give you this aspect. So the Ritu is aspect of time, the season. Ritu means season. So season means the kala, the time. So at the specific time only you are supposed to get conceived. There is a huge amount of direction given in a Charaka Samhita also, that which should be, what time it should be that you should get conceived, and how it should be, typically it has been said that you have to get in more when Ayurveda definitely consider the Jyotisha aspect also, and that's how also both the horoscopes are been checked. Again, if you don't believe that and don't want to go that much deep, that is a different story, but those aspects are being mentioned there. So that is one aspect. Then the Ambu, more than Ambu, is the whole nutrient which is being provided for the development of whole uterus and the body. So here that dietary aspect which I was talking about, that you should be physically fit to even go before you go and choose the pregnancy. So that way dietary aspect should be taken care. Then it comes as a kshetra. When we talk about kshetra, obviously for the female, the kshetra is uterus. And how that uterus is completely ready for getting conceived. That's how that kshetra should be considered. So locally also you should be free of any other disease and be ready for that pregnancy, as that's how the kshetra or the uterus preparation can be considered. Or if you're suffering from some kind of menorrhagia or any other menstrual disorders, or PCOD or those other things, that should be all been taken care, and that's how the kshetra should be prepared. And then comes the Beeja. And Beeja here means for both not just for the female aspect, but the male aspect also. So for female aspect, the Beeja comes as a ovum. So that ovum, how would you make the ovum perfectly fine? Or how do you want that radiant ovum only, that absolutely fully mature ovum should come into the uterus, should receive that mature ovum? And the same way, it is also necessary for that male to create the highest amount of sperm count, and that to be absolutely normal sperm count, because that's another complete issue which we are talking about. So in infertility we will discuss that, but at this point, so when these are the requirements, then what is the simplest solution? If somebody would ask me, obviously I would say that it is absolutely better that both the parents, to be parents, should go for the doing the Shodhana Kriya. And being saying the Shodhana Kriya, I would even recommend doing the panchakarma aspect is recommended. So it's a process, right? Like just think about then when you are somebody to parent getting married, they get married, how many days they do the preparation. So this is how the Garbhadhana Sanskara it's considered as one of the ritual in our, at least Ayurveda recommends that it as a ritual. So that's how you have to prepare yourself. Hence the Shodhana is important. That's bottom line is, yes, the Shodhana Kriya is important and it is absolutely practical, nothing wrong in it. Give yourself a good time and do the Shodhana Kriya. Then I'm coming to your second point where you're talking about the counseling, how do you prepare yourself? So nowadays there are these counselors available, that how do you raise the kids and how do you do, how the parenting should be. And that's a good idea. But I think earlier this was not really a problem because we used to be a joint family and people used to actually get ready with it. And now this with nuclear family, this becomes the necessity. And again, I'm not opposing that. However, it is not must. Like how I was saying that you have to prepare and do the Shodhana Kriya, which would be must. But the counseling, it's up to everybody's personal choice. Whether if they don't feel comfortable, yes, there are counselors available for this and they should go for that. But not necessarily that they have to do that. In spite of that, I would say, if there are issues, definitely you should go. And if you don't feel confident, whether I would be able to become a mother, would I will be able to handle these things, definitely counselors are there and one should go for that. But comparing 1 and 2, or like as one being the how do I prepare myself, I would suggest that thinking about the Shodhana Kriya would be a wise choice. And again, going for a counselor or not, it's individual approach.
Thank you, madam. Thank you. So going to a counselor or not is a chance. So what we can or cannot take, but preparing for conception is a choice. So that is what Ashley madam said. So beautiful interpretation and a lot of ideas put into this, madam. Your experience really counts here while discussing these factors. Madam, having said that, so we are speaking about the preparedness and the other things. What about those people who don't have the facilities or do not have time or do not prefer to go for Shodhana? So what would be your tips for them? And what are simple things to note down before conceiving? Like if the couple are with you and you are telling them how to conceive, and so you are a counselor, so like they have come to you and you would recommend Shodhana for those people. So, but they're either not ready for Shodhana or they don't have time or anything. There may be many factors. where Shodhana cannot be brought into picture. So what is plan B? So that would be the question from our clients. So how do we address this one, and how do you give hints to them or educate them to know? They may also ask a question: how should we know that we are prepared enough to conceive? So after speaking about Rutukshetra, Ambu and Beeja, Shodhana being out of the picture, so what is plan B for them?
Yeah, so of course, and many times practically also this thing happens that people are not sometimes ready for it. So my first recommendation, what I generally would do is definitely number one advice would be that make yourself prepare uh, at the level of diet. Make yourself prepare at the level of lifestyle. So how do you do that? So number one recommendation is stop all the fast foods or the shortcuts. Shortcuts means cooking shortcuts I'm talking about. So when you're cooking, many times people say, oh, you don't want to cook the whole full meal. Maybe just make something one dish and then go ahead. And that's okay. However you want to eat, but make sure that as Ayurveda says that your diet should be full of all 6 tastes and not just one thing. This is, having said this, there is another major approach here is that I generally would say, and this is again those who want to get conceived, my first recommendation is that 6 tastes. I would recommend having 6 tastes, but along with that, I also say that think about that your plate should have at least 5 things. And what would be those 5 things is one bowl should be of obviously vegetables, but one bowl also should be of uncooked vegetables or the raw vegetables. This is kind of not that the full diet. I'm not saying to eat complete salad, but one little bit having that is very, very necessary. Then one bowl should be of some kind of dals or proteins or something that way fulfilling. And then the 4th bowl should be for some aspect of rice or wheat or chapati or grain, any kind of a grain thing. And then the 5th aspect I would still recommend for having as buttermilk or the curd, some kind of that aspect has to be there. So this is how the full meal I'm talking about, and not just making only one thing and and moving around. So it could be idli dosa, it could be many things. It's not necessary I'm talking about the rice and the chapati. It could be many other things also, but these aspects have to be there in the diet. And along with that, to another thing I would always tell them that no matter what, you have to have 1/4, like you take the lime and then cut it half and then again further cut it half, and that much every meal you should be having at least at one time, lunchtime you should have. And along with that also I would suggest the best way is to add the ghee on the diet. So that way start eating the proper meal and not having the shortcuts of the meal. That would be the first recommendation. Then the second recommendation, and I would always recommend them that do not just jump on, okay, you decided now, convinced that yes, I have to, you have planned everything and so okay, now I want to become pregnant. No, wait, at least give yourself 3 months. Now why these 3 months? Because you're going to change your diet. You're going to observe yourself in this 3 months. You're going to really getting prepared that what I would need as soon as I become pregnant. And that type of education we give them in these 3 months. If they don't want to go for the panchakarma, that's fine, but at least this way they get ready. And then comes the actual kala aspect, the time aspect. So I give them really the education of when really the whole menstruation explanation, that when you are actually fertile, the day 5th to day 16 or 14, that aspect you're really ready. So before that, have the abstinence and then have the actual contact during that period. That aspect also I generally suggest them, which enhances the chances of fertility more. And then after, this is how they are actually preparing. The 2 major aspects have to be taken. Not we focus only on the female, excuse me. We focus also on the male. Now how male can be prepared, right? People generally think that, oh, it's only the female's job to be prepared. But no, that's not true. Male has to be prepared also. And the best way, again, for males to prepare could be having starting to going for the more fruits, as well as the having the milk preparations that would also help them to get ready to enhance. And in addition to that, if there are certain other stressors, we generally would add some herbs. Then these herbs completely depends upon what are their stressors. Many times males are with the job pressure and all kind of thing, and that time introducing them with ashwagandha or some other type of, like, there are many things can be added, and more shukravardhak aushadhis can be given there during that period of time. And so this is how we would still be preparing them for the, even if they don't want to go for the Shodhana, these aspects can be still be taken in consideration for having a good radiant child.
Thank you, madam. Thank you for highlighting on those very important points. So when we sit with the couple, so couple have a lot of problems. There should be somebody go-to person. As you said, we used to have joint families where our own counselors, like parents or grandparents, now also, so they're the best counselors available. And out of all, the husband for wife and wife for the husband are the best counselors who can run the show of the family, and also how to expand. So how exactly they need to work out. So everything is about sitting on the table, speaking together, and working out things. So having said that, beautifully touched upon the nutrition part, so the rasa part, how much a man and a woman who are planning to conceive should focus on their nutrition. The other two parts of the upastambhas are also equally important. So like Nidra and Brahmacharya. So what suggestions we can give for the couple who are planning to conceive about the Nidra and Brahmacharya. So these three things, Ahara, Nidra, Brahmacharya, we are seeing as upastambhas are the supporting entities for our life and for many things happening in our system. Madam.
Yeah, so that's a very beautifully point you mentioned that, yes, Ahara, Nidra, Brahmacharya. And as I mentioned, a lot about Ahara, but when we actually talk about the lifestyle, my point and my focus is always on Nidra. See, Nidra is another extremely important aspect in one's lifetime, because if you don't have sound sleep, you know what happened, right? So having the sound sleep is a truly important aspect. And those three months which I was saying, that your focus should be on your lifestyle, there our focus is to prepare them to create that nice dinacharya for them. And in that nice dinacharya, the very three things we focus on, the number one thing is Nidra. Whether you're able to sleep on the time, whether you're sleeping restfully, and whether you're sleeping nicely, sound enough that you feel next day happy or the enthusiasm. So that becomes the one point. Then the second point of the aspect is whether the food is being taken on the right time. So where the lunch has to be main meal, and the dinner should be sufficiently eaten before before going to bed. So whether there is a distance between dinner and the sleeping time, at least 2 to 3 hours of distance are there. This is the very crucial third point we recommend. And that's how the whole aspect of dinacharya goes. Again, one important time everybody must remember during the Nidra is not that every time you can just think that, okay, I'm taking 8 hours of sleep in any time of the day, right? Any time of the evening or any time of the late nights. People sometimes say, okay, I'm going to bed at 1 o'clock and now I'll get up at 9 o'clock. That is also not allowed, because those 8 hours are to be actually in that Nidra aspect, has to happen from 10 or 11 between the 6 or somewhere just before the sun rises. So those 6 to 8 hours are crucial, and not that you choose any your 6 hours. That has been also very, very important regarding Nidra. And coming to the Brahmacharya, as I mentioned to you, that we recommend, having the meaning of a Brahmacharya is not just the having, not abstinence is not just the meaning of the Brahmacharya. Brahmamiti acharayat iti Brahmacharya. The way how the Brahman is, that's how you have to behave, which means actually the other aspect very very important aspect of Brahmacharya is attuning yourself with nature. The Brahman is the whole nature. The mother nature is the whole aspect. And if you really attune yourself, how the nature goes, and that's how you behave, that is also considered as a Brahmacharya. I was, before explaining this point, when I was telling you, when I was talking about that, we do recommend some kind of abstinence also, because as you save the Shukra Dhatu, obviously the more and more natural Shukra Dhatu would create. And when menstruation is going on for the female, we strictly recommend to not have a sexual contact. And that way, having that obviously, and then, when she becomes fertile from the 5th or 6th day, not that immediately it has to happen, but the ovulation actually happens between the 12 to 14 days. And if that abstinence has to be done, then it can be helpful sometimes. So all the aspect has to be considered more. I wanted to tell one more thing, that we generally recommend for female, for before getting prepared, I generally recommend to have black gram into the diet, urad, what we call it as. And there is a research reference, that black gram actually creates the more secretions, vaginal secretions happens nicely, and which can becomes the coitus very easily. And that's why it has been recommended to have the masha, what we in Ayurveda we call it as a masha. So those aspects are very, very crucial for preparing both the parents to be parents.
Thank you, madam. Thank you, and thank you very much for that important tip of masha. So being used, and where exactly and why it needs to be used. So a lot of things to explore and a lot of things to learn from these things. So, and we'll touch upon a few questions, a couple of questions in the question box related to this topic as we speak about the preparation of conception. Kalpana ji comes up with a question. What are the thoughts on freezing embryos or eggs for not only for carrier, but in case of cancer at early age and before starting the chemo for delaying pregnancy? So that's the question from Kalpana ji.
Yeah, freezing of embryo is advisable considering these points, but freezing of embryos and then delaying the pregnancy unnecessary. I mean, if you have some other issues, absolutely fine. There is no problem. But people sometimes go beyond. There is no actual physical problem, but they want to make a career, and that's the reason freezing of embryo is done. Then that may not be that much advisable. The reason is not that I'm saying freezing is wrong. Freezing is right. If you need to freeze, definitely go ahead and do that. But just because we can freeze it, I can take a chance later. That may not necessarily right, because as you age, it's raising a child. Your strength is also important for raising a child. You have to consider that also. If age is growing up, your strength may not be that much. What your strength a yuvati you would have. Yuvati is that 16 to 40 year is absolutely the age of strength and that pitta dominance, how we understand as, right? So then it actually starts going towards the vata dominance, and that aspect may not be always good. And that's why if you ask me how about freezing the embryos, I would say yes, that is good. But if you say I'm freezing the embryos because I have to focus on my career now and I'm not really interested getting pregnant, I'll achieve something and then I'll become pregnant. Well, you have to think about that body may not be the same how you are. So that point has to be considered.
Absolutely correct, madam. So the body may not be the same. So with advancing age, very wise point to think over. So we have science, we have technologies, we have all different methods. So where we can postpone and procrastinate the conception and also the planning a baby, but everything comes with limitations and within brackets that we need to see what are the limitations. And so we never know what happens in the future. So right decisions, like right things need to be done at right times. So right decisions should be taken at the right time. So that's the wise thing about that. So coming to Kalavati ji's question. Ma'am, you said that ladies who want to conceive has to prepare herself, especially the Rasa Dhatu, to be taken care. what should the husband do? I think
That's
Aspisha
good.
madam has also addressed this point already. So just clarifying the question.
Yeah, so husband, see Rasa Dhatu. Now here is the Rasa Dhatu preparation also good for husbands also. I mean, on the level of diet, as I mentioned, that they have to prepare themselves. Not that, and specific two things I have recommended that Shukra Dhatu. To make the Shukra and Rasa Dhatu nice, the best aspect could be the milk. Milk is a very good aspect, which is considered as a Sadhya Shukra Kara. So that's how milk I'm saying. And then added with some badam or the almond in it, and again saffron is also a nice. So that could be done. If the more strength has to be increased, then there are some herbs which are I have already mentioned about the ashwagandha, but there are multiple safed musli or the kapikachu or the even the shatavari aspect. It could be a wonderful thing to enhance. Gokshura is also there. These herbs are very good. If that is needed, that can be taken. And increasing the fruits into the diet is also another excellent idea. And with that, remember the fruits with the seeds in it, which you can eat seed along with, right? You don't remove those seeds and you eat along with that seeds. Those type of fruits are also very, very good too for the Shukra Dhatu and the Rasa Dhatu to increase. I mean, that's how the husband should get prepared. And this is the direct, like, I think I told you about the diet and the lifestyle already. And so I'm giving here specifically the Aushadhi aspect.
Thank you there, madam. So having touched upon this point, so what's your take on the Vajikaranas, the Vrishya Aushadas coming into the way of preparing the couple for the conception? And what is the exact area to introduce the Vajikarana? So now a specialist can just, even for the couple who are planning, so without even thinking about many points of consideration, so the doctors may just prescribe, if the a counseling part is there, what should I do? Among many things, there may be some Vajikara Dravyas or Vrishya Dravyas in the list. Is it wise enough to prescribe just like that because we need to prescribe? Or as a physician, what is the responsibility to prescribe the Vajikara or Vrishya Dravyas for the couple who are planning to conceive? What are the limitations, and when exactly we should plug in those medicines?
Vajikarana, people, this is a very important aspect. I think it is a cornerstone of Ayurvedic treatment, where Ayurveda has these Vajikarana Dravyas, first of all. So that itself is a very important. But with this, we do have the responsibility. We cannot just keep on prescribing Vajikarana Dravyas. That, as I said, the counseling and the preparation method has to started. You don't necessarily immediately start the Vajikarana Dravyas, or you can first start developing the strength aspect of the male. And then when actually there like Vajikarana Dravyas also come into the two aspects. One are the Sadhya Vajikara, and the other could be you can prepare them a lot. So for example, Ashwagandha, not necessary. You can just give for the Nidra Janana also, it would work. The stress relieving also, it could be work. So those type of Vajikara Dravya, I mean, that is also still considered Vajikara Dravya. The Rasayana Dravyas could be used first, and then the actually only Vrishya Dravyas can be given later on. So later, in the sense, when as I was talking to you, remember that about the Kala aspect, right? At certain period only you are supposed to do this. That period of time, the Vrishya Dravyas can be given. And before, you should be choosing the Dravyas which are Vajikarana but also Rasayana, like a Gokshura, right? Or like a Ashwagandha, or even like a Safed Musli. So these Dravyas can be given before also as a Rasayana aspect. And then you want to actual enhance thing, that time you can introduce Shilajit, that time you can introduce Kapikachu. These aspects can be given later on. So that is the job of Ayurvedic Vaidya, that when exactly given, and that's why I'm so much emphasizing on the Kala aspect, right? The period, the time. That is very, very important. So there is no direct formula for this, like give only this and then do this. But general aspect, if I have to tell you, then I would say yes, choose these first and then choose the remaining.
Yeah, thank you, madam. So it's so like the responsibility of the physician as well. If the couple are seeking something, So now there are like Google patients or the clients who come and ask, doctor, we are planning to conceive. So can you prescribe some Russia medicines or the Vajikarana medicines? Okay, done, boss. So just prescribe, signed, and give and take these things. So everything will be good. So, but is it really necessary or not? So should I prescribe or not? So that becomes the responsibility to make a choice of whether to prescribe Vajikarana or not, and where exactly to plug in those medicines. So will be the responsibility of the physician. So to prescribe those medicines. So thank you for clarification, madam. And two more questions we have in the question box. So before we wind it, you can keep your answers short, madam. So because we're running out of time. What is the Ayurvedic perspective on IVF? That's a question by Kalavati ji.
Yeah, see, again, IVF you do when there is a necessity. That is the last choice. You always, in infertility cases, we try with everything, and if nothing is working, then you go for IVF. It's the last choice when everything is been failing. And so now what should we do? That's how I would look at it as a IVF, and not that is something, first thing I would recommend. These are the just the solutions, certain solutions. See, infertility is a big issue, right?
Thank you, madam. So Kalavati ji's one more question is, when is the heart formed in the baby? As I've read in the 5th month, maybe I'm not correct, but when they do echo in the 2nd month in the Western perspective, they say the heart is already formed.
Very good question, and thank you for asking this question. So when we say in Ayurveda that heart form, and that is, by the way, in the 4th month, not the 5th. The meaning 5th month, the mind develops. So here it is very, very essential for all Ayurvedic graduates and all Ayurvedic students to understand this, that it forms means not that it starts forming. It is there, but it becomes vyakta. See, vyaktatva is very nicely explained in Ayurveda. The whole body is ready actually in that zygote, right? The one sperm and the one ovum, when unites, forms the zygote. And that zygote is constantly multiplying and creating the whole body. And by the time of 9th month, then the whole baby actually gets formed. The anga pratyanga being formed, but everything is in that small one cell, right? So they are formed there, they're taking place there, but their actual vyaktatva happens, the strength, the liveliness, or the more development happens, that's into the month of 4. So according to the echo in the the 2nd month in the Western perspective, they say that the heart is already formed. It's not the structural aspect here. It's the more as a mental aspect. And remember again that that's why in Ayurveda we call it as 4th month starts, and you can actually after 3rd month you can absolutely hear those sounds, very nice clear heartbeats also being heard in Ayurveda. For that 4th month it is called as a daurudhyani, having the 2 hearts. Now what is the meaning of these 2 hearts? And that's why it has been mentioned also that whatever she feels like eating, provide that. Correct. So the perspective here is that now the baby has started operating from heart. Now he has more, ichhas or desires. And that's how that female, the pregnant woman, will have those desires. So here the manifestation of heart is actually taking place. The physical preparation keeps on happening. There is no doubt about it. And that may be in any that's why you hear the heartbeats and all that. But now the actual action and the activeness of heart will happen during the 4th. And that's why we recommend it as a daurudhyani in that specific period of time.
So thank you, madam. So that's a vital information which we should know. And well said about the manifestation. So just like we also have theories, a mango seed will already have mango in it. So that is why the only mango comes out of it and not the apple. So that it's a point of manifestation. That's all. The vector point was really immense. That's the philosophical aspect of the conception and other factors which we need to look through the Ayurveda lens. So that word was like, frame that word, vector. So that's very important. Thank you there, madam. So the last question for the day, madam. for the couple planning to conceive, the contraindications, a quick list of contraindications. Don't do these things. Absolutely don't do in block letters. What would be your advice?
So they're trying to conceive, right?
Yes,
They're only on. So
Yes.
people say this, that basically and you have to have again, there is a certain things, but according to me it is absolutely contraindicated that in early stage the time the conception has to happen, and many time in the apana kala they try to do the conception, which Ayurvedically I would not recommend that to do it. It is in the first prahara of Ratri is recommended, because Nidra Sambhava Kala only the actual conception has to happen, and not early morning. And people do that, we get up early morning and try to do it. Early morning period is said for the Panakala, and so that's how I would recommend that don't do, that may not be the right thing.
The contradictions means, so I was also meaning this was an important point. So like maybe related to exercise, or so the limitations like smoking, so alcohol consumption, that people may have a lot of queries, but your quick list on things which should definitely be avoided from modern and Ayurveda perspective both.
From the modern and Ayurveda perspective, becoming focused for that thing, what you are supposed to do is the most important. If you I would suggest that is the most important thing, that take it as a very seriously, again, as a choice and not as a chance, and give preference to it. Allow yourself to be ready. No alcohol for no one, not female, male, absolutely no tobacco, no alcohol. These any kind of addictions, you have to get rid of it. I don't have to say this. This is like absolutely from the beginning. One should get ready when we are already talking about preparing themselves, right? Not if you cannot prepare yourself, at least these other things you have to have under control. That is absolutely true. And another very specific thing which I would have to suggest, maybe keep yourself open. Many times people are very restricted, that I want a male child, I want that kind of thing never should be doing. Having a baby is God's gift. Except that, whatever it is, go for it. There is in Ayurveda, we do have the Pusa Vanana, and I have done, again, my work has been done in that Pusa Vanana. Also, maybe sometime later we can discuss on that. But my recommendation will be, whatever God is giving you, it itself is a great thing. Accept it and move ahead.
Absolutely, madam. So was like nailing. So accept what God gives you, or this destiny has some plan for you. We shall not meddle with that. So boy or a girl, it doesn't matter. So that both come in the form of wonderful emotion into our life. So whatever. Having the child, so what child would come into our life, male, female, twins, whatever, let it be a point of suspense until it is revealed. Let it be under the wraps. So, and once it is revealed, let's enjoy that as it comes. So with this particular note, on behalf of all the participants and the beautiful family of Easy Ayurveda, who have been in almost all our sessions and supporting us, a heartfelt thanks to Ashlesha Rawat madam, and thanks to the wonderful audience here. And until we meet the next time, lots of love from Easy Ayurveda. Thank you and namaste.